Welcome to American Medicine Today, presented by the Bonati Spine Institute, the world leader in advanced spine surgery, featuring the internationally acclaimed inventor of the Bonati spine procedures, Alfred Bonati, MD.
Hi, I'm your host, Kimberly Brumell, and welcome to American Medicine Today, brought to you by the Bonati Spine Institute. Every week, we try to inform you about the Bonati Spine Institute and other medical news, share some of our patients' miraculous recovery stories, and discuss what we feel is the crisis in American medicine today, also known as Obamacare. Today we'll visit Morphogenesis in Tampa, where they are making amazing breakthroughs in the fight against cancer with their pet and animal trials, and discuss when human trials will become available. We'll also hear from Dr. John Grossmith and Kelly Nelson, a Bonati Spine Institute patient, in our Back to Life segment. And we'll hear from Washington Times columnist, Fox News contributor, former member of the President's Council of Bioethics, and New York Times best-selling author, Dr. Ben Carson, about his new book, One Nation: What We Can All Do to Save America's Future. Finally, we'll speak with Dr. Bonati about these topics and how changes in American medicine today will affect you. And recently, I had the pleasure to visit Morphogenesis in Tampa to speak with Dr. Patricia Lawman, CEO and co-founder, and Joseph Scanlon, Chief Operating Officer, to see the remarkable work they are doing fighting cancer, not only in pets, but very soon in human trials.
This is what we call our hero wall. These are very exceptional animals. Unlike laboratory animals where you would have to induce cancer, these animals have what is called naturally occurring disease. So they're like people in that they have contracted cancers of different types. And they're obviously outbred, many different breeds of animals, even different species of animals. But we call them our heroes because they've given us so much valuable information of how we develop our cancer vaccine for the treatment of more animals, but also people. We take our bacterial gene for the marker, the big red flag, and we put it inside the tumor cells. The tumor cells express it on the surface, and then when they're deposited in the skin, the immune cells see that red flag. They can't ignore it. It's like, I am a tumor cell, I'm foreign, take me out. And so what happens in that process is that these immune cells, they actually eat the tumor cells.
Oh, that's
yes,
fantastic.
they do. And then they display all the antigens, all the markers. So where the immune system couldn't see the tumor-specific antigens before, now they can't ignore those. And so we're just educating the immune response to the tumor antigens that are specific to breast cancer in this case. So that's how it works.
And there's no side effect?
It's no side effects because the immune system is smart. It only recognizes what it has been taught to recognize. So it only seeks and destroys the cancer cells. It doesn't touch the normal cells or healthy tissues.
So in other words, you're retraining the body to something that it didn't spot as a foreign object. Now you're teaching it, hey, here's the disease that you have, and boom, all of a sudden the immune system kicks in.
That's right, because when you get a bacterial infection, it's obvious that that's foreign. But cancer cells are they are our own cells, so they have very subtle differences. So sometimes the immune system can see them and take them out, and other times they can't. So we're just educating the immune system to do what it normally is supposed to do.
What type of success rate do you have with the vaccine as it stands right now?
Well, I think it's fair to say that if the animals are in a healthy enough state to live where they can receive the 5th vaccine, which is about 2 months, they stand a very good chance of recovery and what we call stable disease. So when we're talking about cancer treatment, we're not always talking about a cure. I mean, cure is like what everybody wants. In some cases, the vaccine is curative, but what we're trying to maintain is a chronic disease. Instead of a terminal disease, a chronic disease. And so what we have seen in the veterinary field is the quality of life is excellent. And that's the #1 goal of veterinary oncologists, is to provide a longer life, but a better quality of life.
Of course, that's fantastic, letting people know that there could be a viable option out there for cancer treatment.
Very soon.
When you talk about the vaccines, I guess a question that comes to mind is, you talk about it's being introduced into the body. Is it a shot? Is it a patch? Does it take a surgery to introduce these things?
Not at all. When it's actually administered, it's introduced into the dermal part of the skin.
Okay.
So as it happens, there are a lot of immune cells in that layer of skin. So our skin is the largest organ in our body, and it is our biggest defense against invading organisms. Most people don't realize that. But as this defense, it has these immune cells right in the skin. So what we do is we put a vaccine depot, these tumor cells that have now been marked, so that they're directly accessible by those immune cells.
You know, Patricia, everything that you and your husband are doing through Morphogenesis Inc. is absolutely incredible. But I think better directed this question to you, Joseph. How do you get funding for Morphogenesis? I mean, is it private funded, government funded?
I'm glad you asked the question. We've been very, very fortunate. You know, we did receive a few $1 million through different grants and that type of thing, but most of our funding has come from private investors, and they've been extraordinarily, how would you say, supportive of the operations here. And they make all of this possible. I think it's important that we realize that everything in this room is paid for. We don't have any debt in our company. We've put in systems just like what VJ is doing in here. Everything is real time now. It's sent up to the cloud immediately. We can track everything we're doing, how it's being done, what species, what animals. We can trace every pet right down to the day and how it's been treated and what it's been treated with. And I find it remarkable. And again, the private investment has been a great thing for us. And members of this community have been terrific supporters of us, and we truly appreciate it.
The canines that you treat, don't they have a comparable immune system to humans? And why is that so important with ImmuneFx?
Yes, I think that's one of the cornerstones of why we created veterinary oncology services. We see it as a mechanism to help pet parents and their pets, but also because, as you say, canine cancers are very similar to human cancers, and dogs' immune systems are very similar to ours. So the hope is that everything that we've learned in canines and felines and equine will be directly translatable into humans. So one of the big issues for people in investing in small early stage companies is that it's such a high risk. But basically we've de-risked, right, the veterinary completely, and we've de-risked the human because the human first trial is do no harm, and we've seen absolutely no side effects in any of the animals that we've treated.
The problem with the cancer is that the cells of the body that they defend your body, they don't recognize the tumor. And they don't recognize the tumor because it's your same cells. So when you do that, then the cells are really camouflaged in your body, and the problem with that is the cells, the cancer kills you because they don't recognize, the body does not present defense, gets weaker and weaker, and then suddenly is being affected general, and the person die, or the animal die. With this trick, what they do is they make those cells that they are invasive to the body. They're invading the body. So immediately the cells that defend the body, the mast cells, immediately start to produce in massive amount a defense mechanism. So it's an incredible idea. It's simple, it's extremely wise, and the results that they have is amazing.